Dr. Sunil Maske. I am a consultant urologist and renal transplant surgeon at Dr. D.Y. Patil Hospital in Pune. So today we will discuss about kidney stones. So what is kidney stones? Kidney stone basically it is a hard object that is formed inside the urinary system because of excess of minerals and some chemicals in the urine. Now we will discuss how the kidney stones are formed. So, urine has many minerals and chemicals that are in dissolved form. When there is a excess of these minerals and chemicals, they will crystallize, they will form layer by layer, and ultimately they will form a stone. Now we will discuss the common symptoms of kidney stones. Kidney stone patient generally presents with a pain in the abdomen that is very severe in nature and it radiates from loin to groin. There is a associated nausea and vomiting. Patient may have blood in the urine. If there is a associated infection in the kidney, patient can present with fever and chills. Now we will discuss the types of kidney stones. There are four types of kidney stones: calcium stone, uric acid stone, struite or infective stone, and fourth is the cystine stone. The most common stones are calcium stone. About 80% kidney stones are calcium stones. There are two types of calcium stone: calcium oxalate and calcium phosphate. Those patients with a high calcium in the urine will have calcium stones. The second type of stone, that is uric acid stone. 5 to 10% of kidney stones are of uric acid stones. Uric acid stones, these are formed in acidic urine. In patients with a diabetes mellitus, gout, patients with a chronic diarrhea, and those patients with a high intake of animal protein. The third type of stone is a struite or called as an infective stone, which is formed in patients with a chronic urinary tract infection. Fourth type of stone, which is less common in less than 1% of the patient, is the cystine stone. Cystine stone is common in patients with a condition called as a cystinuria. We will discuss what are the risk factors for kidney stone. There are multiple risk factors for kidney stones. Common is low urine volume. So low urine volume is present in patients with a dehydration, with a less intake of fluids, those who are working in hot conditions. Second risk factor is those with a history of chronic diarrhea like ulcerative colitis. Third is diet, which is also a very important risk factor in kidney stone formation. Patients whose intake of calcium is higher will lead to calcium stone formation. Those whose intake of oxalate is higher will lead to oxalate stone formation. Excess intake of animal protein also lead to uric acid stone formation. Those with a history of stone in the family also has a risk of kidney stone formation. Obese patients also at a high risk of kidney stone formation. Those patients which are on vitamin D or calcium supplementation are also at risk of kidney stone formation. There are some hereditary conditions like cystinuria or distal renal tubular acidosis which can also lead to kidney stone formation. Conditions like hyperparathyroidism also lead to calcium stone formation. We will discuss how to prevent the kidney stone formation. The most important is adequate water intake. At least 3 to 4 liters per day water intake should be there. Second, eat foods with a less oxalate content. Eat adequate amount of calcium in the food. Reduce the intake of animal protein. Also, reduce the intake of salt. Have an adequate amount of fruits and vegetables in the diet. Now we will discuss the treatment options in kidney stone. So the treatment options in kidney stone, it depends on the location of the stone, what is the size of the stone, whether kidney is obstructed or not, whether kidney is infected or not, or whether there is a pain or not. So it is divided into medical treatment and surgical treatment. So medical treatment is offered in patients with a small kidney stone where there is no pain, there are no signs of infection and kidney is not obstructed. So we can wait for 3 to 4 weeks for the stone to pass. If the stone doesn't pass after 3 to 4 weeks, then he will require endoscopic surgery. Now, surgical treatment is indicated in those patients with a large stone when there is a kidney is obstructed and when there are signs of infection. So, surgical treatment is basically endoscopic treatment in which there is no skin incision. There are two types of surgeries for kidney stone. One is a PCNL, in which we made a small hole in the kidney through which we insert the endoscope and the stone is broke with laser. The hospital stay is 3 to 4 days and patient can resume his normal duty after 1 or 2 weeks. Now, second type of surgery is a RIS, which is a retrograde intrarenal surgery, which is the most advanced treatment for kidney stone, in which we insert the endoscope through the urethra. That means there is no hole in the kidney, there is no risk of the bleeding. So, through the endoscope, we insert the laser and the stone is broken. The hospital stay is 1 or 2 days and patient can resume his normal duty within 1 week. Now we will discuss what are the complications if the kidney stones are not treated. If the kidney stones are not treated, it can lead to kidney obstruction and ultimately it will lead to kidney damage and acute kidney failure. Impacted stone for long duration can lead to stricture formation in the ureter and it will damage the kidney. There will have a lot of pain, recurrent urinary infection, and so there will be an impairment in daily activities. So friends, when you are suspecting kidney stone, so immediately consult your urologist. Thank you.